r/AskReddit. Doctors of Reddit, what is the most bizarre issue you've seen a patient trying to hide or mask? I admitted a guy for pneumonia, which was odd, because he was young and strapping, no other medical issues, x-ray didn't look quite right. The pieces just didn't add up and, so I started questioning him more closely. Me, do you use any drugs? Patient, drugs? That's disgusting. I'm no fucking druggie. I've never touched drugs in my life. I move on to other questions and suddenly, patient, look, doc, I just want you to know I may have used cocaine once or twice years and years ago. I just snorted it though. That wouldn't cause this, right? Me, how long ago? Patient, like 10 years, maybe longer. Me, it shouldn't be affecting you after this long. Patient, more like 5. Me, yes. Patient, like 5 months ago. This goes on forever until he admits he just got off a massive crack binge the day before, where he spent the past 3 days in a hotel with some loose women smoking crack non-stop. He finishes with, but I don't want you to think I'm one of those dirty druggies. No, I think you're the idiot who lied and was getting treated for pneumonia instead of getting the proper treatment for crack lung, which is what he had. Here's a tip, I genuinely don't care. I'm not your mama, your spouse, or your priest. Don't waste my time and endanger your health spewing bullshit. Whatever horrible twisted thing you think is too shameful to talk about, I promise you, I've seen worse. Nurse here and I'm late to the game. I've seen some shit, but in this story, the patient tried to hide something, and I paid for it as well. Was working at a teaching hospital here in Nala as an agency nurse. As some of my fellow agency nurses can confirm, when the staff nurses find out an agency nurse is coming in, we get the patients that the other nurses don't want to deal with, in essence, the shittiest patients on the floor. Literally and figuratively. I got my reports and was making walking rounds with the nurses going off shift. We walked by a patient's room and he wasn't there. Outgoing nurse says he's always going down to smoke and that he's very demanding. He was a homeless patient there for an infected arm from fourth drug use. I asked the nurse why was he being allowed to leave the floor regularly with an fourth in his arm and she just shrugged. About an hour later, my patient finally reappears and shuffles into his room. I make a mental note to go in that room next for my assessment. After I finished giving another patient their meds, I go to walk in and the door is cracked. I hear snoring, so I'm knocking as I open the door. I say, hello Mr. Addicted to Heroin, I'm Tattoo Joth Queen and I'll be your nurse today. He doesn't flinch. I know he's not dead because I could hear him breathing. I place my hand on his arm and gently shake him, and Jude comes out of it screaming like a wild bear, waving his arms, cursing, and flings the bag of white powder he's holding right in my face. I hit the code blue button because I'm legit terrified. This dude is freaking the fuck out, and I look like Frosty the Blowman with a yet unidentified white powder in my hair, on my face and the shoulders of my scrubs. The code team runs in with a crash cart, sees me, sees freaking out patient and grinds to a halt. Someone runs out and calls security, and a big fella of a respiratory therapist pins the dude down. Security runs in and handcuffs him to the bed. Nursing floor manager starts grilling him about the powder, and I hear him start insisting that it's baby powder and I scared him while he was cleaning up and he threw it on me. That's really the last coherent thought I had. I come to in the and get the story from the doc after all the security footage is reviewed. Dude was going downstairs, meeting his supplier, and bringing the goods back upstairs, cutting his supply more with hospital supplied baby powder that he had been requesting for chafing, going back downstairs, and having his customers meet him in the parking area. He had passed out after shooting up into his fourth in the parking lot, and I came in and scared the hell out of him. He had thrown a baggie of heroin and baby powder in my face. My husband had to come get me, and I was given a note in case the agency drug tested me in the near future. I also had to give a statement to police. It was simultaneously the best and worst day at work I ever had, and subsequently the last hospital shift I have ever worked. Not a doctor, but I'm sure the doctor would tell it. TLDR had an infection and had a hands-on experience I won't forget. I was 12 and I had an infection in my scrotum and tried to hide it hoping tea would just go away. I was walking funny and it eventually turned purpley. My parents got very worried and spoke to me about why I was walking funny. Finally had to show my mom my crazy swollen purple testicle and we went to the doctors the next day. While there I explained the situation. They needed to do tests, so I was given morphine and so they could ultrasound my nads. There was a super attractive nurse doing the ultrasound too. She got clear jelly all over my balls. It still hurt, but man, if that wasn't one of the first rock hard erections I ever had, I don't know what was. I was so weirded out by the whole situation. First I get an infection in my balls. Then I'm given morphine. Then get jelly slathered all over my balls. Then I see one of the prettiest girls in my life, and she touches my disgusting morbid sack. I tried desperately hard not to smirk, because it still felt kinda good, also being ticklish, but every couple seconds I would giggle and smile, but then a quarter second later it would hurt and be painful. So it was a roller coaster, especially for being so young. It went on like that for at least 5 minutes. Don't really remember what the problem was, but if I recall correctly I had a bacterial infection, but it cleared right up, and I was fine. I think the only lasting effect from that was that women with short hair are still very attractive to me. Doctor and nurse, if you're reading this, thank you, but holy shit was that confusing. May I answer as an RPH who has worked with pharmacy clinics? Edit. Okay, here goes. There is nothing anal in the following story. About 7 years ago, just a few years into being a pharmacist, our community pharmacy decided to put in one of those urgent clinics, cheaper than an more accessible than an urgent care. A young woman with a broken, misshapen face enters. My first mother bear instinct was, oh god, her boyfriend beat her. I know that is a really horrible conclusion to jump to, and I felt bad as soon as I thought it, but at the time, what I saw in front of me was a young woman with blood-streaked brown hair, holding a broken nose. Her eyes were puffy and purple. I take her to the back room, and I snag the nurse, and have her start helping with cleanup, and I wait to see if I should call for a dispatch. Nurse tells me a few minutes later not to bother. The woman had not been in a fight. She had not fallen. There had been no car accident. She wanted to slide down her staircase on a mattress and smacked into her front door. It took 4 hours to find out because she refused to tell anyone, and when the police threatened to put her butt in jail, she confessed. Side note, after 3 hours of being monitored for cranial damage, the police dispatch was called. They were trying to get a statement, even a nothing is wrong. She did not say one thing or another, just refused to answer. So they told her, tell us, or we will have to hold you for obstruction of justice. I do not know the law in this sort of situation, but one of the nurses told me that when it comes to public safety, the cops have to find out if someone is about to re-enter a dangerous home, note it and give her help information. Even if a boyfriend had hurt her, she did not have to press charges. So I do not know anything about that, and cannot comment further. Edit 2. Oh, I just thought of another one at the same clinic. A man came in who had decided to see how many fish hooks he could put into his skin around his hand. The fish hooks were still attached to wire that his cat wanted to play with. Several of them ended up embedded into his hand tissue. I do not think he still has the cat. Oh, there was the woman who came in with something lodged in her ear. I do not know what it was, but the doctor had to go into my office to laugh. I'm not a doctor, but I had buddy who texted me at 6 AM saying he was constipated, and it was hurting him trying to go. Traffic was backed up on the highway, so I took the back roads there, but they were poorly maintained and bumpy, and after 15 minutes he asked me to get back on the highway because the bumps were causing some discomfort. We get to the end, and he has a very hushed conversation with the nurse. As soon as he sits down in a chair in the waiting room, 2 nurses come out to help him into an exam room. I go over and ask the intake nurse if he's going to be long, and she says, oh yes, he's going to be admitted, with a funny smirk on her face. The next morning I wake up again at 6 AM to angry pounding on my door. I open it to find my buddy's older sister, who had never been to my house before, and the only weight she found was driving around my neighborhood looking for my car and pounding on doors, but there was at least 4 other identical cars to mine in my neighborhood, but I digress. She was looking for her brother because he never came home the night before, and I was the last person he was seen with. So I tell her I took him to the hospital the morning before, and he was being admitted. So we all caravan down to the hospital, we all being his brother and 3 sisters, dad, and I, to find out what's going on with him, and why he hasn't told anyone where he was. We get to his room just after his doctor gave him his post-op consultation. Turns out he had an 8-inch rubber dildo lodged in his ass, and my taking him on the bumpy road caused it to go even farther up, so they had to make an incision in his belly and manually massage it from his colon back out. At document. PTS routinely lie to me on a daily basis. I used to take it personally, but I have come to terms with it. About a third of what I see in a given day is related to complex psychosocial issues, and not real medical problems. Young girls who fake seizures for attention and their overly protective parents feed into it. Homeless people who swear they are going to jump off a building so they can get a meal under bed. The intractable headaches or abdominal pain with huge negative workups who really just need narcotics or attention, or both. I've seen people flat out lie through their teeth all because they can't deal with the stress of life. Just last night a young male who got out of drug rehab 5 days ago comes in with abdominal pain. This can be a rather expensive and time-consuming workup with labs and court scans, etc. I flat out ask him if he is using again and he denies. He is obviously high, but screams when I examine his belly. As such I get some labs and a urine drug screen. Positive for meth, heroin, coke, and THC. Labs NML. I talk to him again. Sorry doc, I was embarrassed about using again. He had come to the because he started shooting heroin again and was ashamed. I talked to him a long time about addiction etc, but he didn't want any help. I have hundreds of stories like this. The problem is that I have to take their complaints seriously. Alcoholics and crazy people still have real medical problems, more than normal people, and they sue when we miss them. The lack of trust between physicians and patients makes my gig hard. I'm always worried I'll miss something because the part is full of crap, and I'm afraid that if I miss something, I'll get sued for 20 million bucks. Makes me order a lot of tests that probably aren't needed. Yet another reason medicine in America is so expensive. I think probably your best stories will be unidentified rectal objects or psychotic patients. Anyone who has watched Scrubs knows the ass box, and any doctor out of training probably has at least one ass box story. This is my first, and still best. I was in medical school doing my radiology rotation with an interventional group. They did some super cool stuff with fluoro and a wire. One day we were doing a procedure. I've since forgotten which one exactly. I'm guessing something like a percnef. Something with sedation. So the patient had to wait to recover for a bit. Anyways, we do the procedure, and things go smoothly. I went back to the reading room with the doctor caught up on some films. We sat down at the box. This was back when everything was film, so we had the big auto rotator that would spin the next film at you, and he started dictating the percnef guy. All was well, and at the end of every procedure like that they shoot a film of the whole abdomen to make sure nothing really bad had happened. Right then, the specials tech that did the case with us came back, and I'm sure it was like something out of a movie. The whole belly film showed up, and we all cocked our head to the side, completely confused. There were 3 radiopack, bright white, objects down in the pelvis, one shaped like a circle, one more of an oval, and one T-shaped object, all the same size, close together. The tech said, "What are those?" The radiologist was befuddled. Me, with the mid of a child being new to medicine, said, "I think those are push pins." We went round and round. At first, no way, can't be. Then arguing where in the office do we even have push pins to have them fall on his back before we gowned him. Then finally I said they could be inside him. We didn't have a lateral wide shot unfortunately, so no way to know for sure. The radiologist then tried to figure out why anyone would be stupid enough to swallow pushpins, and dear lord, how long had they been in there? After a couple minutes of this with the tech, again I said there's a much shorter distance to get to where they are at. There was a quiet pause. Someone is going to have to tell him what we see. He can't leave until we figure out what that is. Me and the radiologist looked at each other, then at the tech. He sighed and defeatedly walked out to the recovery room. A couple minutes later, he came back, I kid you not, as white as a ghost. What did he say? Well, I told him the procedure went well, no complications, stents in place etc. Then I mentioned we took the last shot to make sure we weren't missing anything, and when we went to look at it in the room, we noticed some metallic-like objects that seemed to be in the pelvis. They aren't anything we typically use in the procedure, and we aren't sure if they were on top of or inside your pelvis. They looked like pushpins, but we just wanted to see if you knew in it. Then the patient cut him off. Yes, I know about those. Please don't tell my wife. The tech didn't say another word. We were too afraid to ask anything further. The radiologist dictated as best he could. Kinda wish we would have asked more. Still have no idea, and never heard anything more about it. But that plain film is burned into my memory. I can still draw it to this day. Doc here. On the charts it usually states your chief complaint of what is troubling you, and which brought you to seek medical help. Usually it's 2 to 3 words like sob short of breath. Once I had a 20-year-old guy with penile discharge. I looked it up, it's just a yeast infection written as his chief complaint, which really odd. I walked in the room. Hi, I'm Dr. F. I understand you have a penile discharge. Yeah, it's a yeast infection, he says very confidently. It's not a yeast infection, I countered. He hung his head to his chest and shook it. Yeah, it's not a yeast infection, you've got an STD like chlamydia. Still shaking his head. It's chlamydia. I wasn't sure at first why he tried to pretend it was nothing when that prevents proper care, until I went to the next room and met his girlfriend, who had the same discharge and sadly also knew herpes lesions. Felt really bad for her. Not only did she have an unpleasant infection, but she was clearly dating an idiot. Another case, as a resident I took care of this madly addicted crystal meth homeless man in the southern USA. I say madly cause he actually got shot once, and the bullet went through the muscle on the lateral pelvis, not through the abdomen. Well, he continued to smoke, and smoke for weeks on end despite the wound getting infected. At one point it progressed to be an infection of his pelvic bone, osteomyelitis, and he became septic. When you get a bone infection we can try to treat it with antibiotics, but they don't penetrate the bone well and sometimes it's just too late, so the bone has to be removed. He ended up getting a hemicorporectomy. Everything below the belly button was amputated. First and only time I've ever seen this, thankfully. I have a friend that's a nurse. One day I asked her what her worst insertion stories were. She had 2. She asked me, anal or vaginal? So I said, anal. Warning, wall of text. Anal. There was a man that had come into the ER complaining of severe abdominal pain. He was admitted, and while he was chatting with the doc, the man was visibly uncomfortable. So, the doc ordered an x-ray to be done. Once the results were out, the doctor was standing at the x-ray machine, just staring at it, until my friend walked by. Sarah, the doctor said, beckoning her forward, come here. My friend was confused, but complied with his request. However, once she saw the x-ray, she understood completely. Doesn't that look like an apple to you? Asked the doctor, and my friend nodded while holding back her laughter and said, yup, certainly does. The doctor asked the man if he had anything to tell him. The man stuttered, and it took a while to drag the info out of him. But anyway, at the end of this story, the man had to get surgery to remove the apple from his rectum. Though, when a person has an object removed from their body, a complete breakdown of the item has to be done. So, my friend got to look at this ridiculously long report of that the damn apple was made out of, and at the end, it said, looks like a golden delicious. Vaginal. A woman came into the ER complaining of strange discharge from her, you guessed it, vagina. So, she was admitted, and a male nurse saw to her. As a note, the male nurse was gay, and was relatively flamboyant. Anyway, the woman had her legs hiked up, and the male nurse has his head under the blanket, looking at her hoo-ha. But, suddenly, he jumped back, looking terrified. My friend, in about a good-natured ribbing, joked that the male nurse couldn't be that afraid of women, but, then he looked at her, fear and confusion clouding his eyes, and said, something blinked at me. My friend is bewildered, and ducks under the blanket to see for herself. And sure enough, she saw something blinking. Something small, wedged up a woman's vagina, was blinking at her. I'm not sure what happened next, but it was a turtle. A tiny pet turtle. Tad the Vag turtle, my friend called it. The woman, somehow, believed that her vagina was a more suitable tank that which her turtle had been in, and managed to wedge him up there. And, before you ask, my friend didn't know what happened to the turtle, and it still makes me sad to wonder if he went home with his owner. Thanks for reading. A huge, bigger than the wall Trump, will build at the Mexican border, inguinal hernia. I was a med student, doing a general surgery rotation. Usually someone has groin pain, and says something, like I think I have a hernia. You look, see nothing. Then feel, and don't really feel anything, and do surgery anyway. This guy was a big guy, probably around 6 feet 4 inches and 400 lbs. He dropped his pants and I expected to see nothing unusual, but instead his scrotum was around the size of a cantaloupe. I recoiled and said something like WTF. I went and got the surgeon, and didn't prepare her, just asked her to come look at it. She walked in, took a look and you could see the jolt go through her. Then she said it looks like Mickey Mouse. This was because his testicles were perched way up on top like Mickey's ears. Then she apologized, but was a little shaken. We exited the room, and she said in 20 years, including her residency, she had never seen a hernia like that. We did the repair and 18 inches of intestine was in his sac and 9 pounds of fat. I had to push the fat back up into his body. It wouldn't stay. I would get his intestines back in, and most of the fat, and then the pressure would shoot it all back out like a scrotal jack in the box. We finally had to tip the table upside down, and let gravity assist me in getting his guts and fat back in his body. I'm not a surgeon, but asked the attending surgeon if I could just throw the fat away. They said no, it all had to go back in. I still wonder why I can't just throw the fat away. I don't think he would miss it. 2 weeks after surgery he came back for a follow-up. The secretary came and knocked on the attending's door and said Mickey is in room 1. We lost our shit laughing. A friend of mine is a surgeon who works in proctology in an hospital in Switzerland, and that story is pretty unusual. Patient is a very athletic guy in his late 30s, solar bench tanned, very well groomed and all, and he looks very anxious. He complains about intense itching sensation in his anus/rectum area. GP couldn't find the cause. My friend first had a conversation with him asking about any recent unusual activity in that area, but he denied and said 20 times that he's not gay. My friend insisted, saying that he's not there to judge and that it has nothing to do with being gay, but the patient confirmed his first answer. After deep checkup with appropriate tools, my friends found very intense abnormal fucked up irritation which could only have been caused by an external product. But he couldn't guess which product at that stage, and needed to find out to be able to cure it as soon as possible. So he asked again, and the patient denied again. I told you already, I'm not gay. So my friend tried to scare him and went like, sir, considering that you're 100% sure that any kind of substance, product, or object have recently been inserted in your rectum, what I found there is really not normal at all and looks like a severe mutation of some kind. We might need to cut it off to stop the progression, which would imply an artificial anus. That scared him his pants off, and he started talking. Okay, I'll tell you, but you have to promise me that you'll never mention my name when you laugh about my fucked up story with you colleagues. Sir, I'm not here to judge or laugh, I'm here to cure, okay? So, Hugh, I'm very not gay you know, but Hugh, you know, sometime, when the excitement arise, shit can happen. So here is the story. He was having a foursome in his garden with his wife and another couple. They swapped wives, it was fun and all, and then when the excitement arose the women went together, and the men ended up together as well. So that guy was in the passive position obviously, and his partner of the moment was missing lubricant. And they were in the garden, and there was no lubricant, and that was annoying, and there was a few slugs in the flower beds, and there was no lubricant, and they were very excited, and fuck it. Why the fuck not? And they tried using the slugs as lubricant, which obviously didn't work out at all, but it was already too late. So the slugs were stuck in there for a too long moment, and, you guessed it, they emit an irritating substance as a self-defense mechanism. Of course, the guy was so embarrassed that he did not went to his doctor immediately. My friend never heard what happened to the penis of the active sex partner. A nurse here had a patient come in one day who said he thinks he has an infected penis. The stench of this man confirmed some type of infection. The smell was so bad we needed to give him a single room. A doctor and I go in. Doctor to ask the questions, and I was there for moral support and to assess the wound. But mainly we were both there to support each other cause we had the feeling it was going to be interesting. Tries to say he doesn't know what has happened. A few minutes pass, and we decide to take a look. I'm not going to describe it, because it was horrendous. Canon request for all you sickus out there, but after a few more probing questions we get this confession. Look, okay, it was the ice, not me. It was the ice. It is a crazy drug. Me and my girl wanted to get kinky, so I got electrical tape and pulled my penis out and wrapped the tape from base to tip as tight as I can. Then I got a candle and let the hot wax drip over my penis, which kinda burnt. And then I got the ink tube out of a pen and stuck it down my penis. I took that out, but I ended up passing out with the tape still on my penis and woke up the next morning. I pulled it off, but my penis was burnt and really swollen and blistered, and I thought it might sort itself out. This was 5 days ago now, and it's only got worse, doc, so why have you waited 5 days to come and see us, patient? Well, I was embarrassed, so I've been smoking a shitload of weed for the last 5 days to build up the courage. We get out, and the doctor turns to me and says, veteran doc here with many years of experience, that is one of the worst things I've ever seen. I'm not a doctor, however, I'm a patient who hid something very stupidly. Back in February 2014, 22-year-old me was working on my car. Sitting in the driver's seat, I had the dash taken apart so I could replace the hazard switch. I felt the aura coming. That always happens before a seizure. I figured I'd be okay, because I was sitting down and pretty secure. When I came back to consciousness, I was in the most pain of my life. My back was in so much pain that I wanted to die right then, and every time I moved the slightest, it only got worse. I have a problem. Mentally I tell myself that I'm a burden on everyone, and I need to do everything myself. So, I did the best thing I could think of. I tried getting out of the car by myself for 15 minutes. I got one foot out of the car. I ended up texting my best friend's mom to come help me walk inside. Now, before I start telling you about the hiding part, I have to tell you, every time I have a seizure, I can't remember stuff. My brain just glitched. It's rebooting. One seizure, I forgot the whole previous day. One time, I looked at my friend and told her I didn't know who she was. It fucking sucks. But anyway, my friend's mom was my roommate. I didn't know what just happened. I didn't know why my car was taken apart. After I failed to get out, I remembered that I was working on my car, but I still didn't know what happened or why my back hurt. I told her that I was so tired that I took a nap and woke up and think I had a kink in my back, just needed her help to walk me in. She got out there, tried to help me out. I screamed in pain. She asked me if I wanted her to take me to the hospital. I stupidly said no, I'll be fine, just want to lie down. I really just didn't want to interrupt her day off with having to sit in the She finally was able to help me get inside and get in my bed. I asked her to turn the light off and I tried to go to sleep. There is so much pain coming from my back, I'm in tears. Breathing is no longer something I want to do as it just causes me pain. As I'm laying there, I'm just thinking, and then it clicked, I had a seizure. But I can't tell people that, because then I can't drive, and other people will have to drive me to the doctor's visits and to work, and wherever else. I can't be a burden on these people's lives like that. I had to ask her to take me. The pain was too much. Getting back out of bed, down the stairs, and into her car, took longer than it ever should have. Well, now that I'm in the she has to get my whole family involved, and it doesn't help that my cousin was working that day either. Told everyone that I fell asleep and woke up and was hurting. The doctor probably dismissed me as a druggie and just gave me the Loratabs to keep me happy. Then I was discharged. Fast forward a couple months, my sister is tired of me being in pain, makes me go to the doctor. I got x-rays done. It turns out that during the seizure, I fractured some vertebrae in my spine. Later, arthritis set in. I came clean. My sister told me she was disappointed. I felt like shit. Made her a promise to never hide anything relating to my health from her again. I know it was dumb to hide the fact that I had a seizure. I've learned since then. Thank you so much for watching the whole video. Please leave a like and subscribe.